Hello, Angus. Thank you so much for joining me today. And so we can talk about the local opioid and fentanyl epidemic that has currently been plaguing the nation, but especially the Bay Area around locally. Would you mind sharing a little bit of background about yourself and your work with addiction?
Yeah, of course. So my name's Angus McBain. I'm a registered chemical dependency counselor, currently working at Sutter Health over at Mirapol Institute. I'm in recovery myself from opioids, so I know the subject very well. I'm currently working with a lot of clients who are afflicted by the fentanyl and opioid crisis. So it's very present and evident in the Bay Area right now.
Well, that's very interesting. So you have a very unique perspective on being able to have seen both sides of this epidemic. So what would you say currently has been, or recently has been your biggest achievement with this in this sector?
So, it's actually there's not a lot of successes right now with it. The phenol, especially, they're putting it in everything. They're putting it in the pills, they're putting it in the marijuana now. So the biggest thing that we need to start doing is educating the population, especially the youth, that what you're getting, might have fentanyl in it, and statistically, it probably does. So there's a big lack of understanding about how potent it is and how widespread it is in other substances.
Mm-hmm.
So I would say, yeah, if we start educating people, we'll have some more successes. But right now, the lack of knowledge with it is just really crippling us.
Why else would you say that this epidemic is important to talk about?
The biggest thing too is it's hitting the youth. So it's hitting a lot of the children who are under 25. Right now, currently, I'm working in Maripral Institute, which is a private rehab facility. And most of our clients who are coming in, I would say 90% of them under the age of 25 have some sort of opioid addiction, whether it's a polysubstance, but there's definitely opioids in there. And then I would say 70% of that is fentanyl as their main substance. So right now, the biggest thing is the kids are getting a hold of it.
You be able to share a little bit of insights maybe on some of the demographics and backgrounds of the types of people that you worked with? Perfect.
Currently, the demographics and background I'm working with, it's widespread. Especially when we're talking with the opioid crisis. It, like you said, it doesn't discriminate. We're seeing every type of background, every ethnicity, every class of social class and financial class being afflicted by it.
In your experience so far, what are some of the most common misconceptions or stigmas surrounding the fentanyl and opioid crisis, and how has that impacted your work or an individual's ability to seek help?
That's a good question. I would say the biggest stigma around it is the more it's talked, fentanyl especially, the more it's talked about, the more that it's out there, the more that people are getting exposed to it, and the idea of it mainly, they're getting desensitized to it. Your system, the smallest amount of fentanyl will overdose you. So a big stigma around it is the lack of knowledge of how dangerous and how potent it really is. The thing I hear from a lot of my clients is, especially the younger ones, is I didn't realize how quick I got addicted to it. Most people are telling me, especially the teenagers, I tried it one time and I was hooked.
So, considering that a large majority of the clients that you've been working with are all young 20s or even teenagers, what role do you think that universities in our local community, such as, say, UC Berkeley or even our local community colleges, can play in addressing this crisis and encouraging students to get involved in the efforts against it?
I would say a big thing would be, first of all, a big thing would be once again the education behind it, but harm reduction. I realize, and I'm a realist about this. I know that kids are going to use drugs. I know people are going to experiment. I know that substances are out there and they're going to be used. But what we can do is we can do harm reduction. So what schools could do, especially colleges, is have a program where you give out test strips, fentanyl test strips, have a program where you educate people about it. You can give them Narcan. You can give them literature about how to get cleaner or give programs. And that's the whole idea about harm reduction is it's about keeping someone alive long enough until you can actually get them sober.
Building off of that, then, what would you want to see in the coming months or even years in our community? What resources do you think should be available to our community in order to kind of help that situation, whether it be the root of the situation of mental health or even just substance use as a whole?
You know, what I would absolutely love to see is private inpatient facilities like Sutter Health, Kaiser. They only take a certain type of insurance and it's really expensive.
Mhm.
I don't understand why they can't take a couple Medi-Cal clients, a couple low insurance clients, something that the government can supplement, something can fund, so that the people who are really struggling with the drug and alcohol addiction can get the help that they need. So in the coming months, I would love to see, and I know this is a far-fetched thing, and I know it's not going to happen, but fingers crossed, I would love to see the government pump some money in so that private facilities could start taking in some Medi-Cal clients, some low-income families or low-income clients to get them the help and the resources, because that's where the change is going to be. If you can get somebody the right place, the right time with the right resources, their whole life can change. And that's what happened for me. So I know it firsthand.
Yeah, absolutely. So it sounds then like socioeconomic background is probably one of the largest obstacles coming between individuals dealing with substance use issues and seeking treatment.
Yes, definitely.
If there was one takeaway that you would want viewers of this interview to have after listening to us speak, what would it be?
Ooh, what would it be? I have so many things, so many takeaways. Um, my biggest one would be, especially with the kids, just don't be afraid to ask for help. There's such a big stigma about asking for help and that seeming like a weakness, and it's really not. You can just get the message out there that there's nothing wrong with having mental health issues. There's resources out there. I think that would be a good start.
All right. Well, thank you so much for talking with me today. I really appreciate your time and your outlooks on this entire situation.